All right, so thank you guys for coming. This is a stem cell podcast. Let me give you a little background before I introduce everybody. Okay, so if you listen to the show, yeah, I've struggled with my health, my weight, up and down for a long time. And this is my doctor, Dr. Carrie Bordinko, and she's freaking amazing. And in January, I think it was in January, we got my blood tested, and she was like, you know, she calls it like it is. She doesn't like have any. I mean, do you remember what you said something like, "Hey," I mean, you remember? It was like
it was probably something like, "I'm going to be at your funeral soon."
Yeah, something like that.
Oh, wow.
That's what I'm talking about. So that's what I'm talking about. She said you need to get your shit straight, is what she said, pretty much, right? So it was like, you might have to get a stent in your heart because your cholesterol levels. She was like, it's a bad day. I remember you saying, it's a bad day when you have to get a stent put in. And I was like mortified, right? I got 3 boys. I was like, my dad died of a heart attack. I was like, I got to figure this out. And she owns a company called Benacer. What's it? Benacer Health? Benacer
Health.
Benacer
yes.
Health. And in there, they have hyperbaric chambers, and they have the red light therapy, and they do IV drips, and they have massage, and they have physical therapy, and they have a gym. It's an amazing facility. It's on Lincoln. And so my wife met with her and went over my blood work, and it was like, you need to get him in here in the gym. So I started training 3 times a week. And one day, I was working out hard, and I couldn't breathe. The workouts were so hard. And there's this dude on a treadmill, and he's in a suit. And I'm watching this guy in a suit, and that's his workout. He's on a suit on a treadmill. And he gets off the treadmill and he walks over and introduces himself to me. And he was so kind. And he was just like, "Hey, how you doing? My name's Leo." And we just start talking, and he starts telling me about stem cells. Now, stem cells, I've been fascinated with them forever because I remember hearing about Tony Robbins getting stem cells and all these different people in the past, Joe Rogan talking about stem cells. And I've researched it a little bit, but I know they didn't have it here. You had to go to Panama. And Leo tells me he went to Panama. He went to the clinic in Panama. And he said, there's a clinic in Cancun that's better than the one in Panama. He's like, I went to Panama and I've been to the one in Cancun. And the one in Cancun is so much better. The doctors are better. The clinic is better. All this stuff. He goes on and on. I'm like, man, that sounds great. And he goes, Carrie Bordinko, Dr. Carrie's holding this little seminar on stem cells. You should come to it. So I was like, let's go. So I grabbed my wife, Blake and I went to the meeting, and because I was sold, but I had to get my wife, Blake, in on it. And Blake's like, if you want to do it, I'm all in. And the stuff that I learned in that clinic was just so amazing. And I remember coming back in on the show and wanted to tell Rich and Kyle about it, and I couldn't get the words out. I didn't understand. I didn't have the intelligence to repeat what she had said in this meeting. And I remember saying, man, I wish I could get them to come in and do a podcast and talk about it, right? Long story short, I go to Cancun with Leo and Carrie. Carrie's husband, Toby, who's right there, who's amazing, by the way. Toby's right. I mean, he wants no attention, but he's amazing. And Shane, Leo's son, we go. And Annette, Leo's wife, right there. We all go. And we do the stem cell. This is Dr. Rafael Gonzalez. It's his clinic, right? So I'm going to jump around all over the place, but I have to tell you, at one point, Leo and I were in this room in Cancun, which is crisp, clean, medical grade, beautiful facility. And Leo and I are in one room getting stem cells, and Carrie and Toby are in another room getting stem cells. And something happened where Rafael, Dr. Gonzalez, was standing in front of Leo and I don't know, Leo, was it for like 2 hours?
At least.
And he's just talking to us. It was like a one-on-one TED Talk. And this guy was dropping so much knowledge on us about stem cells. I was overwhelmed. I was like, man, if there's a way I could get this information out to everybody, because it's not available in the United States. And I was like, Rafael, if you could come to the studio someday. And he's like, sure, I'd love to. And then, anyway, fast forward to, I remember talking to Carrie a few months later, and I said, because Blake's like, how do you feel? How do you feel? I'm like, I feel normal. I don't feel
always,
anything.
how do you feel? How do you feel too?
Yes,
yeah.
Yes, you are. So, but Carrie she had also gone a couple months before me. So I remember saying to Carrie one time, so do you feel any different? And I remember you saying something about gravity. Do you remember?
Yes, I have this really weird analogy. I said, when you get older, you start to appreciate gravity more than when you're a kid. Getting off the floor gets harder. Getting out of bed gets harder. After stem cells, you forget what gravity feels like.
Right? So I was like, I wonder what is she talking about? But let me tell you something. I'm 4 or 5 months out of stem cells. I completely know what she means. It's freaking amazing. I feel so good that I can't explain. Like, I'm so glad you guys are here. I'm so glad you're listening to this podcast, because what I feel right now is amazing all the time. And keep in mind, there's shit going around my world right now that is dramatic, but the inside feels so good. that I thought, I'm so glad this podcast was planned, right? So meanwhile, cut to, she says, let me test your blood. So she tests my blood. She gets my blood tested. The results come back. And she says to me, your blood work is phenomenal. She says, phenomenal. And I'm like, phenomenal? Like, phenomenal how? Like, phenomenal compared to where it was last time, or phenomenal compared to a person, a normal person? She goes, both. Phenomenal both. So anyway, Dr. Gonzalez is here. Carrie is here. Dr. Bordinko's here. And Leo is here, the man on the treadmill, in the same suit he was walking on. And,
It's his normal look. I mean,
but Leo is an open book. Leo's medical background, what he has been through with stem cells and what he's been through with his health, he's open heart surgery, all kinds of stuff. So he's willing to share everything. So I don't know where to start. Carrie, do you want? Oh, and Kyle is here. Rich is here because, I mean, Rich needs it bad. So anyway,
I've been dead for years. It's fine.
I've asked some of you guys to come personally. Some of you guys listened to the show and heard me and wanted to come to the podcast. So thank you for coming. So I don't know where to start. Peyton is here with a microphone if there's any questions. But first, let's start off with Dr. Bordinko. If you want to say start, let's roll.
okay. Hi, everyone. Thanks for coming. So the topic of stem cells, we're going to do our best to really break it down to some simple concepts. We want everyone to really walk away with a good understanding of how it's helped John Jay, how it's helped a lot of us who do it, and why it's so different that we're actually willing to get on a plane, go to Cancun, go out of country for this, and why can't you just do it in your backyard? I think everybody's, gets on the web. You can see there's stem cell advertisements everywhere for, I read an article that there was 238 stem cell clinics in the state of Arizona. The problem is you have to understand, it's what I call a buyer beware. The way our government views what's going on in the stem cell market is that you have to do your own research and understand what you're really getting. And that was what was really important to me when John Jay and I were talking about why to do the podcast, was to help people be their own advocates and understand how to ask the right questions to know what you're getting, what you're paying for. A lot of times we all know if the price seems a little too cheap, you may not be getting what you're getting. This is not that industry. The prices are insane what people are charging for it, and you're still not getting anything. So you can't use price as your guide. So I'm hoping today we can try and summarize and give you those important questions to ask and understand why. And then, like he said, let Leo talk, because Leo's got the most experience of everybody up here at the table. He's been in the need for stem cells for quite a few years. He's explored that as an alternative way against our traditional medical system, which doesn't give us this as an option. And so he's got some great stories to explain. And what I'm going to do to back that up is, as a medical doctor, just explain what he's been able to do with his body and bring his body into a healthier zone, we could not do in traditional medicine. And I'm a traditional medicine doc. I'm not an alternative. I'm an MD. It's nice that we can actually see people get better, because a lot of times in our field, we just help people kind of get along, and we're actually able to make people healthier now.
You want me to tell my story?
Yes.
January of 2016, I have a second heart attack. I don't realize that I had one 10 months before while I was doing an oral argument in the New York Court of Appeals, and I was in trouble. I didn't know I had a heart attack, went back to the hotel, took a couple of aspirin, and I was in a suit. I always wear a suit when I'm around Carrie and John Jay. So I'm in church with my wife, and I'm feeling the same pain in the middle of my back, no pain in the left. So I say I'm going to go outside and get some fresh air. I go outside, a nurse follows me out of church, and she says, "You're having a heart attack, Leo." And she says, "If you don't get to a hospital, I'm going to call 911. So I called a cardiologist that I had known for years who took care of my parents, and he sent me to a hospital. And that night, John Jay, they put in 3 stents, and I've still got them. That worked for a while. And then my ejection fraction is what the left ventricle of your heart pumps up to the aorta, which pumps the blood through your system. And if it doesn't do it, you get buildup of congestive heart failure. Your body, and as it comes up your body, eventually gets an organ and you die. So I went through to my cardiologist, who was a fantastic guy who's conventional medicine, took me through every drug optimization possibility, and nothing worked. Then he sent me over to the Mayo Clinic, and I did it again, and it was extremely painful. The needles, the drugs, and everything else, we went through drug optimization, and it didn't work. And I have a very good friend who is a Harvard medical guy who is a dear friend of mine, and as it turns out, is a dear friend of Rafael's. And the guy tells me, you need to go out of the country, get stem cells, and gives me all the reasons why you can't get maverick stem cells in the U.S. Tells me the litigation, documentation, and the kind of machines you got to have in the lab. He gives me a tutorial. It's unbelievable. I take notes like mad, can't pronounce any of the words, but I just say, I got to figure this out. And he sends me to Panama. I don't think he knew Rafael and what he was doing at the time. Went to Panama. My ejection fraction was 20, the amount of blood that pumps up to your aorta. At 18, 17, and maybe 20, you're dead over a little period of time. So I go down there, and the ejection fraction goes from 20 to 45. Nobody knows what to do with me. Am I just a freak? So I go along, and everything's fine, and then I get into some more trouble. I have some other heart problems that come probably as a result of the vaccination, which Annette and I signed up for to get right away, and then we had the booster. And probably during the booster, it blew a valve in my heart. So I went and spent 22 days at the Cleveland Clinic. Got out of the Cleveland Clinic this June. Had an ejection fraction of 20. Didn't like it very much. Go to Cancun. My ejection fraction was 30 to 34. I'm going to give it a 34 score because I'm an optimist. And nobody knows what to do. And I asked the people at the Cleveland Clinic, and I probably had the best cardiac surgeon maybe in the world, a fantastic guy. He was also a University of Michigan graduate, which gave him extra credit, and he was living in Ohio. And so I have Cancun experience, and that ejection fraction gets better. And I asked him on the way out, I said, should I go to Cancun? Should I? And I got to know this doctor very, very well. He says, well, I can't embrace it, but you'd be crazy not to. And I thought, wow. Because I'm dealing with what is, I think, probably the best surgeon in this space, maybe in the world. So I'm lined up to go get another treatment at Cancun. Now, Rafael is going to be an abject failure if he doesn't get this back to 45 or 50. But without stem cells, I would literally be dead. And Carrie is the meanest, toughest, most knowledgeable doctor I have ever met. There's no kindness in what you got to do. I'm on a double diuretic. It's horrible. And when I told that story to her, instead of giving me a hard time like most doctors do, she said, tell me more, tell me more, tell me more. So she read all of my records. She thought I was making it up when I told her. So she read every record. She went through all these records. And at the end of the day, she made me come and tell my story to a few of her patients. That's how I got to know John Jay. So we got on an airplane and we went down and had stem cells. It's an unbelievable experience. There's no pain. I've investigated very, very deeply the side effects. If you get contaminated cells in the United States with some maverick, it can kill you. It needs to be regulated. What I saw in Cancun, and what I saw in Panama for that matter, was really, really unbelievable science, cleanliness. The equipment that they buy to screen out the bad stem cells is unbelievable. It's expensive. If the lab doesn't have it, don't go there. That's my story.
Do you see a time where this treatment that is in Panama and is in Cancun, do you see like 5 years out, 10 years out before it comes to the States? Or do you feel like the way things are regulated here, there's no way it's going to happen in our world?
Well, I'm a lawyer, and I sued Pfizer on a big, big case. And I don't think Pfizer and the other pharma's going to ever let them easily get it here.
And why is that? Just because it's too much money to make?
Let me tell you the experience I had at Mayo Clinic. I had the head cardiologist there, and he was telling me, voodoo medicine, and was screaming at me. And I said, what are the alternatives? Well, you get a heart transplant. Well, at my age, you can't get a heart transplant. Then it was, a lot of people, and you've got a little bit of money. Maybe we can skip the line. I said, I'm not skipping the line for anybody, anytime, anywhere. I got to die, it's my turn to die. And I'm a person of faith, so other than leaving my wife a terrible mess and my kids a terrible mess, death is not all that bad. So I don't think it's going to happen for a long time. The cost to go to Cancun or Panama is nothing. And he told me what it was going to cost me. He said, it's going to cost you $300,000. And I knew he didn't have a clue what he was talking about. I didn't say a word. And it's nowhere near that amount of money. I'll let Rafael tell him what the numbers are. But it's cheaper and there's no side effects. And the recovery time is about an hour. Just getting rid of the needle in your arm and staying kind of still, which they ask you to stay. And then you go to the beach. I mean, it's a no-brainer. And let me tell you, I made a deep, deep study. I've got access to world-class scientists. Nobody could describe for me one single adverse side effect. Maybe a headache, maybe a little fatigued. I don't live with headaches, and I don't live with fatigue, so they didn't hit me. But I'm telling you, it was an experience of a lifetime. And now I'm expecting Rafael and his group to get me to 45. If I get to 45, I won't die of heart failure. I may die of cancer, which I've had, or I may die of cellulitis, which I've had, or I may die of everything else I've had. I had a lump in my head the size of 3 golf balls. If I'd have known about stem cells, I might have tried to say, Rafael, can you get that lump out of my head? He would have said no. But it's an unbelievable experience, and it's really, really, really sad. You have to spend the time, energy, effort, and money, and it's ridiculously cheap for what you get. And Panama is a great place. Rafael is at a whole different level, and the doctors are at a whole different level. In Panama, you don't talk to the doctors. You talk to a PA, kind of. That's why I really like Cancun, and Cancun's a beautiful city. And if you haven't seen the Panama Canal, you go look at the Panama Canal. But after that, Panama City, not so good. Okay, that's my story.
Where do the stem cells come from?
Great question. So I'll interject. So I'm Rafael Gonzalez. I'm actually a scientist. My PhD is actually in immunology and spinal cord injury, believe it or not. And during that time frame, back with the Christopher Reeve Paralysis Foundation, for those older individuals that know who Christopher Reeve is, I worked at their center there. And we started doing stem cell research way back 22 years ago. From there, I started studying cells in the body, just all cells. And I like to educate, as you heard me talking that one time, more about cells and what transpires in your body. First and foremost, for instance, I educate a lot for the American Academy for Anti-Aging because that's actually really important, understanding the things that Dr. Bordinko do. Because stem cells on their own, unless you're relatively healthy or if you're prepared for them, not going to be as good as if you're ready for them and if you've taken the appropriate steps with someone that knows who takes the appropriate steps for it. So cells in your body every single day are communicating, every single cell in your body. And what they want to be in is what's called homeostasis, feeling fantastic. Everything is absolutely regulated. And there's communication. One cell releases a signal, a protein from one cell to another to communicate. Simple example stuff is what Leo had, what happened to him. You have a heart attack. As soon as a heart attack happens, the cells surrounding that area that the blood has been cut off have to start immediately communicating. If they don't, you will die. So they have to release a specific type of protein or a couple proteins to find a way to, number one, thin the blood, cause blood pressure changes, try to increase blood flow to the other area to try to form a bridge. Otherwise, what happens? You die of a heart attack. It's got to be something that happens. Your body is in a consistent state that it wants to be happy. It wants to be healthy. And this is where, in many cases, stem cells come in. So stem cells, you can get them in the adult sector in us, what's post-birth, meaning umbilical cord tissue, umbilical cord blood, placental tissue, amniotic tissue, and as adults, you can get them also from fat. People have heard them from fat, and you can get them from bone marrow. Taking a step back, what you hear in the United States a lot is they tell you, I'm going to give you a stem cell treatment, I'm going to extract some bone marrow, I'm going to extract some fat. Understand, stem cell-wise, what you're getting is a needle in a haystack. So when you're about 40 years of age and you extract bone marrow, and I've studied and I have publications, peer-reviewed publications in the scientific sector of bone marrow, when you extract bone marrow from somebody that's about 40 years of age, the amount of stem cells are 0.00001%. That's one. Two is they are as old as you are. Same thing with fat. Fat's a little bit more frequent. There's some more stem cells in fat. Doesn't mean that those products don't work because they have these communication signals in there of other cell types that can possibly work. When you look at it in the context of you local clinics around here, I'm using amniotic fluid, I'm using meshed up umbilical cord. The frequency of stem cells there is really, really low. That's one of the problems. The second problem, even if it's post-birth and it's naive and young, is donor variability. So look at every individual in here is completely different. When we test, because we also serve as a reference lab, we have a US-based entity. We do have 4 clinical studies in the US with our company here that are FDA-approved clinical studies. And when we test others' products that are out there, the variability from donor to donor is significant. The product that we have comes from a publication, scientific peer-reviewed publication, dating 2010, 12 years ago. We've spent 14 years studying these cells and studying the signals that are released. And most importantly, Carrie knows I promote the hell out of diet. The most important aspect of cells is the diet and the condition that you put them in. That's one. The cell, what we call cell lines that we use come from, which is so difficult, completely viral-free donors. What does that mean? Out of everybody in here, 8 out of 10 of us are going to have either cytomegalovirus or Epstein-Barr virus. These donors don't have that. So we've gone through a total of 50 cords, umbilical cords. The tissues donate it. And we grow up these cells, first and foremost testing, of course, the donors, testing everything with the donors. Secondly, and most importantly, is we do genetic testing. That's called karyotype testing. We grow these cells up just like when you grow up anything, or as we mature, cells on a petri dish, they age. The cells that we use are a biological age of about 15 years of age. When you're feeling healthy, when you're young, when you're moving, when you're growing, they're about 15 years of age. That is based on what's called telomere biology, and we can go into another conversation about what is that. It's an aging mechanism that naturally occurs in our body. These cells are of that age. The most important aspect of what you said is where are these cells from? They are pure stem cells. Essentially, we isolate a particular cell, and it's a pure cell population. You're not getting a red blood cell. You're not getting a white blood cell. You're not getting all the different endothelial, all these different. These are pure stem cells. And what you're getting is anywhere from 100, depending on the individual, anywhere from 100 to 200. And going to Leo's, trying to actually get him to 45, that's a hard task. That's going to have to need a lot of help.
It's going to be easy.
Put that out there, the positive vibes,
But
right?
that's a positive, yeah. But it's doable. It's something that's doable, something that's achievable as long as your mind's set to it. And as long as you have everything around it, the support around it of all the different things. If anybody tells you that a stem cell is going to heal, it's going to cure you, I'm going to tell you no. Leo just gave you an instance of how many times have you done this? 3-4 times already?
Done it 4 times.
Yeah, 4 times already. So essentially in the context of, autoimmune disease, specific diseases that we know in the cells that we work with. And how do we know? Because we know what the cells do. First and foremost, one of the most important things is control the immune system. Every single disease, every single one has an immune component. There is nothing more important than maintain immune health. There is nothing. Neurological diseases, heart diseases, all of them. That's one of the things that it does. And it does this by changing a particular cell in your body to regulate your immune system. And it increases those because as we age, those go down. The second most important thing in the context of heart failure, heart disease, is it increases blood flow. As we age, you will notice, you can't get out of bed like you said as well as you used to. You can't pump up. I was in the military, pump out those push-ups when I was 16 years. I don't know how many, but I don't remember how many push-ups. Now it's harder to get out of bed. If you increase the blood flow in your body, you now have oxygenation throughout all the organs. That's why a lot of people like Carrie, we use, HBOT, hyperbaric oxygen chambers, a lot. Because you got to have that increase in vasculature, that increase in blood flow. That stem cells are for everything? No, they're individualized, understanding of gathering what it works for, what it doesn't work for, but it works for many things.
What does it crush at? Like what if you have an ailment, what are the ones like back pain? Does it help with, people have back pain or cancer? Like, is it more effective for one type of ailment?
Yeah, I would, in the context of anything autoimmune disease, phenomenal. And I'm talking about the context of the cells that we actually use. We cannot use those cells here. They're in FDA clinical studies. In Mexico, we're approved to actually use them. We can use them because these are culture expanded in a clean room, in a complete clean area, tested, make sure there's no bugs, no anything in them, so there's no issues with them. Immune system issues, first and foremost, and vascular issues. If you talk about back pain, first and foremost, I look at, I can do, we can do, which we do down there, a direct injection. I think you had direct back injections.
I had 226 million stem cells on a 200 million on IV drip and then 26 million in my back.
In his back. So first and foremost is, as you age, osteoarthritis, all these things transpire. If we do a local injection in a specific area, I'm essentially putting a Band-Aid and I'm helping that area a little bit, which is what transpires here in the United States a lot. But you're going to go down again because you have a systemic issue. So when you consider pain, localized pain, it's inflammation. And if you don't deal with that systemic issue, it's real hard to deal with that localized issue. So you have to do both. In the context, we evaluate each case specifically, understanding what needs to be done, and keeping the safest approach possible that we believe that we can cause an effect.
So like layman's terms, getting the stem cells basically helps your body fight the things like more strong. Like it makes your body stronger to fight things that make
Correct.
come
It
attack
helps,
it.
Yes. Yep.
But then you go see Dr.
Yeah.
Carrie and she makes she whips your ass for the rest of the stuff. Is
Pretty
that,
much.
Yeah,
Yeah.
is that what I'm
Yeah.
hearing? So it's like you got to get your car clean before you put in the good gas in the car. Is that kind of what the most basic
Yeah.
version of it is?
Yeah, 100%. So if you think of like one of the things that Leo said about side effects, so some of the side effect, adverse effects, depending on the individual, if somebody goes in that's really unhealthy, immune system's on overdrive, chronic inflammatory disorders, you put a cell in there and the cell's used to this phenomenal, perfectly balanced food. I'm now putting it into a harsh area. Your immune system's going to recognize this and say, the hell's this doing in here? Start wiping it out. Those are individuals that you commonly see or have some kind of a cough or cold that will have a lot of body aches, flu-like symptoms. That's a side effect of it. It doesn't necessarily mean that the cells are not working because the cells are still secreting out what they need to secrete out. What you used to hear a long time ago about you put a stem cell in, it regenerates an organ, does not do that. It releases signaling cues to try to get your body back to where it needs to be. And it does it specifically based on, I put it in you, it sees what's going on, I now need to produce the deficiency in that niche, in that area, or wherever it is. I need to find out what's going on, what's lacking here. Let me start producing it, because if I don't, I'm going to die immediately. So I need to start producing it, and at some point, the factory stops working. It dies. And your body picks up that cell that was put in there, and it takes it away, and it'll make an immunological change. Your own body heals. So it's actually enhancing, the question was, it's enhancing your own body's ability to heal, to do what it needs to do, to regenerate.
Can you, when you said it wipes stuff out, can this is a good time to jump into what an NK cell is? Or is that a totally different thing?
It's a totally different thing, but that's part of a cell therapy, and we can, it's something else that we do. It's another program that we've picked up. Essentially, this is the cell
Rafael,
in your body.
Let me weigh in on my experience on NK cells. And by the way, I've had stem cells in my knee, stem cells in my torn rotator cuff. It fixed them. I had stem cells in my hip. Didn't fix them. It was bone on bone. It was too late. But I've had cancer, and I had a prostatectomy, and it was a Gleason 10, if you know what that is. Only 5% lived 2 years. And I had a little leftover, and I had radiation. I had all the stuff you did, and I had a fantastic doctor at the University of Southern California. Got a little leftover. Rafael had beat me up. He said, send me 16 vials of blood. You know how much blood that is out of you?
Not that much.
I sent it to him. I sent it over. What do you mean? Who said not much?
I said it's not that much.
Get out of here.
It's less than half.
This
of
Well,
group
yeah, but you're putting
donation.
20 billion
I
stem
said
cells in people.
25.
I said
We did
25.
25 on
The
you.
only, the only
Do a little
guys, the only
competition.
person nice on this panel is John Jay. Between my doctor and Rafael, they're beat you up unmercifully. So he has me do 16 vials. I send it over, and he's going to freeze it and use it and he's going to put it together and put it on a petri dish or whatever they do to make a lot of it. The vials aren't any good. The phlebotomist didn't do this with the vials.
The blood draw the right way.
So he tells me, I got bad news for you. You got great blood, but it's not going to work. You haven't done this right. So I do it again. I'm slightly irritated, and I'm down at the phlebotomist, and they're just pumping it out of me, and I'm saying, you got to be kidding me. I ship it off to him. I talk to him, and I tell him I've got a little bit of a PSA that's starting to come back, even after everything else. He says, well, that's why we did the killer cells, the NK cells, to use it. So I go down there, and he gives me a few 100 million. I don't even know the number. It was
billions.
Billions, whatever.
These are billions.
If he says billions, it scares me. But in any event, I had a PSA test yesterday, non-detectable. I had one right after these cells, non-detectable. Right before these cells, it was detectable. It wasn't a lot, but it was some. And the other drugs that my cardiologist was suggesting, or urologist, I'm sorry, I can't keep track of what doctors I've gone to. I'm a doctor guy. I would have had another round, maybe, of radiation if my body could have taken it. Got the test today, from my test yesterday. Mm-hmm. What was it, Carrie?
Undetectable, yeah.
So I'm a pretty lucky guy.
See, these are the NK cells, which are, because remember,
so natural killer cells. So these are part of your immediate immune response. It's called your innate immune response. They're responsible for three things. They're responsible, number one, for viruses, wiping out viruses immediately, a tumorigenic or a mutated cell immediately, and then lastly, more than anything else, believe it or not, our focus is a senescent cell. Everybody's like, what is a senescent cell? It's essentially like a zombie cell that it's aging.
Cool.
It's like a zombie cell. Yep.
And they're everywhere.
And they are everywhere. So if you think of a wrinkle, it's a lack of collagen fat production. It's a cell that's divided, because all cells in your body have a finite amount of divisions. All they do is stop, occupy space, and cause havoc, a nasty amount of havoc. These particular cells are designed to wipe it out. But the problem is, as you age, these cells no longer become killers. They become office workers, dormant workers, whatever you want to call them. They signal lightly, and they don't do the right job. What we do is the concept of taking blood from you, purifying that particular cell, and then growing them up to billions, activating them, putting them back in to basically activate your immune system to wipe out all those old cells that are there, make new, fresh immune cells come out and do what they're supposed to do and maintain immune health. It's one of the biggest concepts. It's a method of keeping the immune system in a regulatory state.
Does it also help with skin? Because I don't know if you guys can tell, but I'm like very close to all these people. And like, I'm looking at you, Leo, looking at your skin, Dr. Carrie, I'm looking at your skin, Rafael, I'm looking at your skin. You got like amazing skin, like no wrinkles. And I'm like, I got like bajillion cc's of Botox in my face, and I feel like I've got like more wrinkles than that. I'm like, does it help with that
Botox.
too? Because Leo's talking about side effects, and I'm like, maybe the stem cells, maybe that's the side effect of the stem cells. But is it the NK cells or like?
It's the stem cells. A lot of people report after having it done more like you have some flushing, increased blood flow. You got to increase blood flow to the skin, to all the it's the biggest organ in the body, the skin. And you have to increase blood flow to it, and you have to maintain that inflammatory state lower, so you don't get all those wrinkles. You don't lose that propensity of fat plumping, all of that.
But you do get collagen stimulation. I mean, that is something we see overall, because a lot of people who are in the age bracket that are going to go after this therapy, right? They've probably already started their Botox and filler regimen. And what we find out is when they come back, they stop going. And that can actually last a couple years. So it's not something you want to tell people, go get stem cells so you don't have to get Botox, but it's a nice add-on.
Hey, but I will say this. Rafael showed Leo and I a video on his iPad of the NK cells. Remember that video?
Yeah.
Leo, remember that video?
Oh, yeah. Let me tell you, when you get the NK cells, you can feel your body doing things inside. It's a little weird. No pain, but you can just...
It's like Pac-Man. He showed this video of this,
what's going on?
Of this cell that's not supposed to be in your body. It was on a petri dish, and you see these NK cells go in, right? And
wiping them out.
It just literally destroys this tumor cell, just and it's gone. I mean, to know that that's
or an
in your
old
body.
cell, or an old cell.
Freaking nuts. It was nuts.
So for people who haven't like walked down, well, probably most of us in here will walk down the stem cell thing. What do we all need to start eliminating from our worlds that fuel the inflammation to the point where maybe stem cells wouldn't be effective? Like, what do we need to get on top of right now, today, yesterday?
I preach you have complete control over, we talked about that this morning. You have control over one thing. You have control over two things, but the most important thing is your diet.
What
There's
goes in your mouth?
nothing more important than that.
Yeah. And that's the part that Leo, I beat up on him probably the most.
Every single day.
Yeah, remember you gave him like one M&M?
I did. I did actually. Yeah.
We're having dinner with one M&M.
And it wasn't
I was
even-
being nice that day.
and it was the little tiny kind.
Yeah. So, I mean, I think that's what Rafael was saying too, is, you can have all this wonderful technology in so many ways, right? But if you don't treat it with respect, is how I always tell people to think about it. You have to give it a hospitable environment to continue doing the great things it can do. You can't take it out of the petri dish, throw it inside a human body and, put it in sludge, and it's not going to do well. So getting inflammation down is something you have 100% control over. It's what I call the heavy lifting, though. It's the hard choice. It's easy sometimes to take a pill or get an injection, but making choices every day about what you choose to eat or what you choose to give up eating, which is the reality for most people, that's the hard part. But it does make a big difference. And, the beautiful part of that is you can change your diet, get inflammation down, never get stem cells, and still feel younger. And that's a pretty good day.
Yeah. I mean, it's like essentially the smoker. The chronic smoker comes to you and says, I've had this many times. I have chronic obstructive pulmonary disease. You think this will help me? Yeah, I think this will help me. Are you smoking still? Yes, I'm smoking still. I think you're wasting your money and you're wasting your time. You need to quit that first thing, is make that change. And especially if you're going to invest in your health, you need to make those changes. I mean, it's essentially it's an investment on your health.
I did. I changed everything because of Carrie, and it's amazing. All right, so thank you guys for coming. Thank you, Dr. Bordinko. Thank you, Leo. Thank you, Dr. Gonzalez, scientist.
Thank you.
Do you call a scientist? You're a doctor, right?
Doctor.
Okay, we said scientist. I was like, I don't know what you call a scientist.